Next, we're going to talk about care of the child with a trach. And these you will see at clinical. They are something to respect, but not something to be terrified of. So let's dive in and talk about those. Okay, so let's talk about the trach. So we have a trach right here. It is a Bavona. You can see the title here on the trach. This is a 4.0 Bavona. This trach is how this child breathes. So there is a hole directly into the trachea, and this is where the kiddo breathes from. Sometimes kids are vent dependent, sometimes they're not. They're able to just breathe with their trach. You'll kind of see lots of different settings and different things with every kid. But what I really want you to know about is I'm going to talk to you about cleaning the trach, which you will never do on your own, but you'll get to see the nurses do it, and I want you to participate in that. I also want to teach you about the Ballard suction. So the Ballard suction is how we suction kiddos, and I want you to look closely that there are little colored lines. You're going to see these better when you're here in the lab, but there are double striped lines, then there are solid lines, and that is going to come in handy when you are taking care of a kid. You're going to see a sign similar to this on the wall that tells you everything you need to know about this particular patient's tracheostomy. And it's going to tell you what suction color. So it's going to be like double red or yellow. It'll tell you which one to use. And then I'm going to walk you through how we actually use the Ballard to suction trachs. Right, let's look at the top of the Ballard. So the Ballard has a little L piece here. So the straightaway piece is the piece that is going to go onto the trach. So here's the trach, and this piece is going to snap right in here. This piece is used by respiratory. Usually they can instill saline in to clean it, especially these get very chunky and congested, so the saline can thin the secretions and help us suction out secretions. This part, we've talked about the colored bands, and then this is going to be our suction control. Notice how when I squeeze, nothing is happening, but if you see that there is a little lock sign, you actually are going to pull it up. You're not going to break it. Pull it up and you twist it, and then you pull it down. And then you can see that it's like pressable. You can press it down and up. And this is where you plug in the suction tubing. So when we have our suction on, and this is an emergency tool, guys. Sometimes their trachs get plugged up and they have a hard time breathing, and we need to be able to quickly make this work well. So when we're about to suction, we will already be connected to the suction. We have our pressable button here. We have our sign that's going to be on the wall there, and it's going to tell us what color to go to. So we're going to say we're going to go to red, solid red here. So when we're ready to do that, we are going to, it's going to require two hands, maybe one hand for videoing purposes. But I want you to see this window. See where the double red is located? That's the window that we want to see a solid red in. That is going to mean that you are deep enough into the kiddo's trach, to the length of the trach, to make a difference in suction things out. So there is our solid red. We only press the button on the way out. So we're going to press this button, and it's going to make a noise like a slurping sound, like a... And when you're doing this, your kiddo is not going to be comfortable because you are putting a tube down their breathing hole. So they're going to be kind of coughing, frustrated. That's why we like to do this nice and quickly, because it will bring relief to them, but we have to do it quick because they can't breathe, and you'll see them coughing. Kiddos with trachs can't make noise until they get their passy mirror device. So as soon as they get that speaking device, then they're able to make noise and you can hear their voices. But other than that, they're going to be silent for you. So you just have to watch their face, and that's how you're going to be able to tell how they're feeling. Are they in pain? Are they having trouble? Are they coughing? Because they're not going to make noise for you. And then I want to look at the care of the trach. Again, you aren't going to be doing this yourself, but I want you to be familiar so you can participate. So every trach is held on by 2 trach ties. Trach ties are soft in nature. They hook into the trach. You can see here with Velcro. And their job is to keep this trach in place because this trach is our kiddo's airway. So we need to make sure that they can't rip it out. But we also need to make sure that the trach ties are not too tight. So we like to put 2 fingers underneath and make sure there's a lot of room in here. So I would probably go a little tighter on this kiddo's trach, but that's our measurement, is 2 fingers to make sure that it's not going to choke them. And then also, thinking about these kiddos produce a lot of oral secretions that will travel down their chin and down their side of their face, and it will get down here into their neck, and it will get these trach ties very wet, which can cause skin breakdown. So we need to be changing these at least once or twice a day, depending on the kiddo's schedule. They're going to be a little different kind of everywhere you go. It's going to be very kiddo dependent, so you need to look at your orders. But you also need to use your critical thinking to see, like, are these really wet? Do we need to change these so that way we are not causing any sort of skin breakdown to the patient? And then you'd let your primary nurse know, and they can do trach care with you. You're going to see that they will clean it. You may see nurses do the same thing that you learned in the G-tube with the soapy water and the clean water with your cotton tip applicators. Same thing. Others prefer to wipe them down with wipes. So you're going to see different nurses do different things, and that's okay. You're going to, as long as it gets clean and it's nice and dry and we protect this airway, that is going to be our priority. Now, this kiddo is probably a school-age kiddo, so they have a pretty decent neck on this mannequin, but I want to take you over and show you the baby that has a trach as well, and just so you can see the difference, that the baby doesn't really have as much of a neck for working space when you're in here and cleaning. Okay, so here is a baby with a trach. Now, this is a mannequin. This is very dramatized neck. A lot of babies have no neck as far as trachs go for cleaning. So you will see that we can roll up towels and we can prop up their heads just to give us some more working room in here to change their trach ties. And you can see I had shown you the 4.0 Bavona. This is a 3.0 Shiley. So it's a different type of trach on this baby. As far as dressings go, you're going to see every child has something different because this goes down to nursing preference, parent preference. Sometimes you're going to see that they have gauze, split gauze put in here. Other times you may see that the nurses use Mepilex, and they cut Mepilex and they put that skin protectant sticker all around the trach just to prevent skin breakdown. So it's going to be a very personal preference. I personally think this split gauze is probably a little too big for this kiddo here, just kind of big and bulky. But that's what is here, and that's what we'll put back for now. Okay. Another thing I want to talk about trachs is cuffed and uncuffed. So you'll see that this trach has a little port for a balloon to be blown up, and that would be inside of their trachea. So if this baby was ordered to be cuffed and then uncuffed at a certain time, they usually kind of cuff at night, uncuff during the day. That just means that they take the air in and out of here and allows the baby to be cuffed or uncuffed, depending on what speaking valves they're using. And then you'll see that if they're on a vent, the vent will be plugged into this port right here. And it's all kind of works in through the Ballard. One of my key pieces of knowledge, if you don't remember anything else, is that this trach is this kiddo's airway. Never hesitate to call for help if you feel that this trach is in danger, if it came out, if the patient's oxygen saturations are low, if the patient is coughing. We need to know about it, because if it's a plugged trach, we need to change it and change it quickly. So please don't hesitate to let people know. And then also just always make sure when you're checking your rooms that you have all of your emergency supplies. You have your suction canister. The suction canister has tubing and a lid. You have your trach board, which you'll see when you get to the hospital. It's a board that hangs on an IV pump pole, and it has all the emergency supplies needed for trach changes in an emergency. So those are all really good emergency supplies to have at the bedside when you are taking care of a child with a trach. So go ahead. I want you to practice the Ballard. I want you to practice changing the button from pressable to non-pressable, and you just kind of lift and turn, and then it's non-pressable. So practice all of those things and you'll feel so much more comfortable for clinical.